We're going to go over another case of acute uncomplicated appendicitis. This case is a non-contrast study. However, I think we'll find that a lot of the same principles apply. So we'll go through this one as well too. And again, similarly, we have our axial and our coronal here. As we scroll down, we will kind of keep an eye out for the terminal ilium, which it looks like is right here. So if we do a little bit of co-localizing, we can show it on the coronal as well too. And look at that. That is the fatty ileocecal valve. So that's terminal ilium plugging into the cecum right there. And it doesn't get any better than that with regards to this fatty ileocecal valve. So that looks really good. So now we're going to look for the appendix because we know where we are at. It's going to be somewhere around here, and it looks like this is a pretty good candidate coming off just the bottom here. And it looks like it's blind ending, tubular structure. We'll co-localize here as well too, and when we look on the corona, it looks like that appendix is just coming off going inferior. And already we get a sense that there is quite a bit of fat stranding inflammation all around the appendix. And if we measure it like this, I think we'll find that it's a little enlarged. So maybe about 1.3 centimeters, 13 millimeters. Okay, so looks like a pretty good look for acute appendicitis because it's definitely the appendix, blind ending tubular structure. It is inflamed. There's periappendiceal inflammation. It's dilated. Even though we don't have contrast on board, we can really make all of those findings, and it even looks like there's a little high density, calcification in there, probably a little fecalith too. So in the end, we're able to make the diagnosis, and then we can do the same thing where we look for our complications: free air, free fluid. Doesn't look like we have any free air. Looking at our lung window, there's no free fluid really. Maybe a little bit of reactive, trace free fluid, but no focal fluid collections. So this is another case of acute uncomplicated appendicitis.